Okay, my friends, relatives, and well wishers, family members, very good evening to you. We're calling and speaking with you once again from the beautiful land of Guyana and from the, what do you call Georgia, Dr. Richard? The mountainous state of Georgia.
Yeah, I'll take that.
Welcome to our program once again. It's Thursday and it's May 8th. And I don't know, it seems like I said many years ago, when Easter comes and goes, the year normally races. It's going faster and faster. And so many things are happening all over the world. We have to brace ourselves for, I guess, speed. You know, when you're sitting in an aircraft and it's taking off, it kind of throws you back in the chair a little bit because of the speed. So there's a lot of torque, and the year is flying by, and so many things have happened. So many things are going on. Um, I don't know, Dr. Richard. There's so many people who are sick, getting sick more. More people are getting sick. We're having more cancer. More and more persons are showing up with cancer in different parts.
Yeah.
We're seeing more influxes of coronavirus and bronchitis and pneumonia.
Hmm.
Um, I don't know. It's it's crazy because also along with all of that, we're seeing more parasites. We're seeing tons of parasites in people, not one and two types, but we're seeing seven, eight, nine types of parasites and worms in one human. I don't know what your take is on all of that. And then uh, we're having some issues in Guyana at the moment.
Yeah.
Probably aware of that, and it would be very difficult not to mention anything about it. But it has been a sad state of affairs the last few days
Yeah.
with the loss of life of a young infant, not young child.
Hmm.
She's 11 years old, and it threw the parents and family members and even the whole world actually into turmoil because they're trying to discover or cause of death
Hmm.
and what really transpired at the situation where they were trying to have a day of outing. I know you heard some of it, but you probably don't know all of it.
No, I don't know of it, and the little that I know is very troubling. Uh,
Yeah, it's mind-boggling, and I don't really want to say too much about it because I know we're being monitored and we're being looked at, and they're persons who are placed in position to watch what we say. And if you say the wrong thing, they censor you and all of that. So
really? In
oh
Guyana?
yeah, yeah.
Wow. Didn't know that.
Yes, it happens. It happens in Guyana.
Mm-mm.
Uh, so we don't know all the details.
Mm-mm.
Many persons don't know all the details, but the father and the mother of the child are very suspicious of some wrongdoings
Mm.
because the child just didn't disappear. The child was taken somehow. This is a very smart. She was a very smart and intelligent 11-year-old who had just written Common Entrance or grade six and waiting on the results. I understand she was very intelligent
Mm.
and beautiful little girl. And they still don't know really what has all happened with this child. I know you went through a bout of in your training in medicine. You were either a witness or were involved in some autopsies and so at some point in your life.
Mm-hmm.
And I remember you used to send me uh, images of conditions that would be responsible for people's death, like the brain, what was happening with the brain, what was happening with the colon, things like that.
Yeah,
No places or names, but
yeah.
conditions were, you exposed me to some of the conditions because of the, I guess, of the severity of the causes,
Hmm.
the outcome. For instance, smoking. I think one had to do with smoking. I
Yeah.
know that one clearly, where we were, where I saw what the lung looked like. It
Mhm.
was kind of chalky, when it was dark. I remember that clearly in my head. I never forgot it. Even the brain was messed up because of the smoking.
Yeah. Yeah. Yeah.
You know,
Hmm.
so you would have some idea more than I do about autopsies and um, findings and all of that. But they did an autopsy on the girl. Supposed to be three pathologists, forensic pathologists, were responsible for doing the autopsy on her, and um, the results that were what were broadcast by the persons here in Guyana is that she died by drowning. Um, well, strange enough, 2 weeks later or less than 2 weeks later, uh, a drowning occurred at Linden at the Tukon Mall pool.
Mm. Yeah. I remember. I know what. I know.
You know of that too.
Yeah. You. I sent you.
This was just about 2 days ago.
Yeah. Yeah. What happened
I
there?
sent you images of that, and
Yeah.
I was alerted early the morning by the current proprietors there at the mall.
Hmm.
Uh, Called me and told me what occurred. This gentleman, I can tell you about this because it is open.
Hmm.
This gentleman is someone that I knew.
Oh, you knew him.
I knew him, and
Wow.
I saw him as late as Monday afternoon. Last Monday afternoon.
He was a caretaker of the premises.
Was Yes, he was one of the caretakers,
Oh, he's one of.
one of them. Yeah, I
Mm-hmm.
saw him on Monday before I drove to town. And for those who don't know town, like, town is about 65 miles from Linden,
Mm-hmm.
and I drove to town that afternoon, leaving him there. And it was very shocking when I got the call and was told that this gentleman was at the bottom of the pool the morning that morning. I just got to work, and I saw pictures of him at the bottom of the pool, and he had drowned. According to the cameras, which are working, um, according to what was told in the young ladies, the young girls, the child situation, the cameras there were not working, but the cameras at the Tukun Mall are working, and the cameras recorded everything.
So what happened? Oh, you can't say right
No,
everything.
I can say because it is already known,
Oh, it's already solved.
already solved.
Okay, so the cause of that is real. He drowned it, right?
Yes, he drowned. He did drown.
Now, what's
And
the
what happened is
the
that
manner of death? What happened?
the man of the the cause of death was drowning.
Right, the manner. What
The
happened?
manner in which he experienced the drowning is what was displayed on the cameras, and then the autopsy was done. Okay,
Hmm.
according to the autopsy, he suffered
Asphyxia.
a, a heart condition.
Oh,
Yeah, I learned that this morning. A heart condition.
so he had a cardiac arrest.
He had cardiac arrest apparently in the pool,
Hmm.
and um, there was another condition that he had that was mentioned. But when you look at the video, you can see clearly, and this is where cameras are so important.
Hmm.
When you look at the video, you can see clearly that he walked back into the pool after going out into his apartment, and entered the pool area,
In the deep?
undressed himself. This is a person who knows how to swim.
Yeah.
He knew how to swim. So he undressed himself, it's all on camera, and he died. He went into the pool. No warming ups, nothing at all. You know, he swam, I think, one length of the pool, and the pool is long, it's not short. He swam one length of the pool, and then he went back again. And before, he was just about 2 feet from the wall, based on what I saw in the cameras. He was about 2 feet from the wall when he encountered the medical condition,
Oh wow.
which was detected in the autopsy. And
Oh,
you could clearly see on the video that he was struggling. He had one hand in the ear and he was struggling to partly stay afloat with the other hand. And this struggle occurred for maybe 30 seconds or 20 seconds or so. And then maybe through exhaustion and maybe the heart gave out on him,
mm-hmm.
um, he just started going under.
Wow.
Yeah, that's the first time I really saw someone drowning. I'd never seen that before.
Drowning and there's nothing you can do to help. That's very, very.
No one, there was no one there. I don't know why he chose to swim at night. There was
Right.
no one else there with him.
Yeah, that's not a wise thing to do.
No, it's never a wise thing to do. With all that water, you alone in there, that's crazy. So when he got down at the bottom, strange enough, he was found the next morning by his daughter,
Oh my
who
goodness.
was calling for him, yeah, calling for him and didn't get an answer. And she looked around a little bit around the mall area, and then she went into the pool area. She saw his clothes on the deck, and then she started screaming because she knew that he was in the pool somewhere.
Oh man.
Yeah, so she looked in the pool and saw him at the bottom of the pool, face down,
Wow.
stretched out on his body. Yeah, yeah. So she's the first one that saw him, and then she went back to her cousin, who is the current proprietor of the pool of the complex. Um, and he came out, saw it, and then called me right away.
My goodness.
Yeah, I told him to call 911, get them to come out there with, call the police, call whoever it is. Don't do anything, just take pictures of everything, take the video, whatever, and so on. He said, well, the camera is on all the time, so everything was recorded on camera.
Wow.
Yeah, but it was really sad. But what happened is that
Mm-mm.
it is all over social media. Excuse me, and the comparison is being made with a young lady who was found floating in the pool the next morning. The little girl, Adriana is her name, young Adriana, 11 years old. The contrast was made between him and her.
Mm.
It was said in the autopsy that she died from drowning,
Mm-hmm.
but she's on the surface and he's drowned and he's at the bottom. So uh,
Oh.
there's a lot of speculations about all sorts of things going on now.
Mm.
And
Yeah, I
I
can
think
see.
they're going to do a second autopsy on the young child to determine really what the cause of what contributed to her death. So that's where we are here now.
Mm.
It's quite peaceful here, but it's quite peaceful here, but we don't know what will happen because we're still awaiting the second autopsy.
Mm.
That's it in a nutshell.
Well, that's a big nut.
It's a coconut.
Wow.
I don't know if any nuts get bigger than the coconut.
That is something else.
Yeah,
That is. I mean, that is too close. Too close for a comparison.
Yeah, yeah, it is really, it's really,
I don't understand that. That is that's
it's amazing the occurrences and how close they are. You know,
yeah. It's too. That's coincidence. That coincidence
strange coincidence.
is that something to say? I mean, I don't know. Wow.
Yeah.
Yeah. But the thing is, and I know I'm not a pathologist or anything like that, but I know there are when they taught us in school, in medical school, there's a difference between freshwater drowning and saltwater drowning.
Hmm.
You know, uh, freshwater drowning usually, the fresh water enters the lungs and it's absorbed into the blood. So you can actually see if you were to do an analysis or something like that. Um, you see water in the blood.
In the cells.
Mhm. Yeah,
Hmm.
you know, and it's there are people that's what they do every day, pathologists and forensic pathology, but they're gonna need even in this case not so much, but because you have a credible witness, the camera,
Yes. Yeah.
you know.
Yeah.
But in the other scenario, they're gonna need some other investigation to determine the manner of death. I mean, was it all that transpired around this young lady? Was she in the pool by herself or something? I mean, what's the was it what is the situation with her? I mean, because I don't care how old I mean, she was young. Nobody should let a young person like that just go by themselves to a pool.
She wasn't by herself.
Okay.
She wasn't by herself, as far as I know. As far as the information goes, she was taken there with by her grandmother, and she wasn't alone. There were others with them, and um, she went to get a band to put on her hand or something like that.
A ban? What do you mean?
Those bands you put on when you enter some place.
Oh, would you pay for the thing and then you
Right, something like that. Yeah, yeah.
and what happened after that?
I don't know. I have no details.
She ever came back to the pool?
I think she went back to her. Yeah, she did go back to the pool.
Mm.
I think she went back, and then what happened after that, I don't know. I don't know.
So she was not with some a group or something, or
She was with her grandmother and some other siblings, I think,
at the pool, the grandmother.
family members. Yeah, yeah, yeah.
So they would know that when she went to get the band and then she came back to the pool.
I think she went back, and then we don't know what happened after that. I don't know, but I'm quite sure persons who were there
Yeah,
and witnessed some of what transpired will be able to say what
because
happened after that.
if they know she went for a band and she wasn't by herself, uh, there's a lot of things that are not really adding up. With just that little scenario. You know, who were
Yeah.
the people she was at the time? Who last saw her? I mean, all those things. They I don't know the scenario, but if you with a group of people, usually you're drowning like that. With that man, see, he was by himself.
Right.
So if you're with a group of people, and I'm pretty sure if they see you struggling, they won't let you drown like that.
Well, there's a whole lot of stuff there because no one saw her in the pool. The pool was searched. Um, it is said that an instructor was there teaching persons to swim at the same time.
Hmm.
When she was discovered missing, he ordered them out of the pool, and he searched the pool himself.
You're kidding me.
Yeah. Yeah, that is in the media, and he didn't see anything. And
Wow.
then uh, there was a drone that was used also. Um, no one saw anybody there in the pool.
And the drone recorded the moment people were in the pool swimming and all that.
I think the pool was empty.
Oh, it was empty at the time.
Yeah,
Well,
yeah. But then the next day, I think the next morning, the pool was searched again or looked at, and not too long after that, she appeared
mm, nah.
floating on the top of the pool.
Does the pool have a compartment that you can go? Did they look at the
That's
pool?
a very good question. Very good question. There's no compartment
Did they drain the water of the pool?
after
Okay.
afterwards. But there's a lot of speculations about different things, and it is strange that if a person is drowned, which I know about that because in our training, we spent a lot of time on drowning and how to prevent it from happening and so on.
Hmm.
But we know that at Linden, where our parents had their business, we witnessed a lot of drownings.
That was a sad thing. I don't like that.
Yeah, I didn't like it, but we witnessed a lot of drownings,
It's true.
and we saw persons in difficulties who went under from a distance, and of that water was brown water too,
Oh yeah. The
right?
water in the oh,
The
you mean
river,
in the lake or in the
the
creek,
river, the river.
the river? Yeah, yeah, yeah. All right.
Yeah, that was brown water,
Mm,
and when they came up uh, face down, swollen.
mm-hmm,
The color of the skin was different, like all like whitish color. We saw that, and it was clear that they drowned it. They came up like 2 or 3 days later,
yeah,
right? And then we had one in the lake. If you can remember the lake by us in industrial area,
yeah, man. There were
right?
too many, man. Too many, too many. I
Yeah,
didn't like that
there
part.
was some that happened in there, and
Mm,
the same thing happened. They didn't come up right away. It took them a couple of days or so, and then
mm,
they surfaced. And when they came up, um, that lake was a clear water lake, but it appeared blue because of the sky. Remember,
mm-hmm.
it was clear. You were small. I was bigger than you, but whoever went in there and drowned and came up, same thing happened. They came up. The color of the skin was white or different, and they were swollen and all of that. So um, I don't know what condition
Mm-hmm.
that body was in. This guy that drowned in the pool at Linden, they brought him up. When they saw him, they went down and got him and brought him up.
But you didn't have no scratches or no,
No, no, no, no, no, no,
no.
no marks of any, no marks of um, any type except for what he had on him.
Mm-hmm.
And it was clear that he suffered and then went down on the cameras. You know,
You know, and a person like that, when you look in the heart, you see all that bleeding. You know something happened.
yeah,
You know.
in the autopsy.
Mm-hmm.
Yeah, they would figure that he had some type of arrest of some sort.
Yeah, yeah, most definitely. And you drink a lot of water. That's why he was at the bottom.
But for persons who are watching and listening,
Mm-hmm.
the few things that I learned about being experiencing difficulty in water, because we were taught that too, things to do if you experience difficulty in water. Um, you don't panic.
Yeah, stay calm.
It is easy to panic because it's a danger that you're experiencing, and You just can't drink all that water. You can't. You're gonna, if you attempt to drink, you're gonna suffer. So they taught us not to panic. First thing. Second thing is that we were taught that we need to be calm.
Mm-hmm.
Try and float, because the more you fight, the more traumatized the more you're traumatizing the body system, and it will bring on panacea. You will panic, and then you can go down. So they taught us that we should float, and then if we can, try to paddle with your hands.
Mm-hmm.
Lay on your back and paddle. You know, so that you can breathe air without being in the water, because your head is up now. Your nostrils are up, and you can breathe air. You breathe slowly. You don't breathe quick. You breathe slowly while you paddle in. And they showed us how to paddle. Paddle with your hands like um, like a dolphin or a fish would paddle
Mm-hmm.
with the fins. And then you just try to find yourself moving towards the closest part of the where the shore is, if you can. But we were also taught other things. We were taught to float with the gear that we wore, like the hat, our hat.
Mm-hmm.
They taught us how to float with our
You're
hat.
talking about the Navy, right?
Right,
Yeah.
exactly. They taught us to float with our hats. They taught us to float with our pants, our shirts. We had to do all of that while we were in the water,
Mm-hmm. Take your pants
simulating,
off.
yeah, simulating a difficult situation.
Mm-hmm.
We had to take off our pants in the water, take off the shoes, take off the pants, and you would tie the bottom of the pants. You
Mm-hmm.
make a loop at the bottom. You're in the water doing all of that, right? And you're not touching ground either.
So if you don't know how to float, you'll be done.
So that's why they taught us the first thing is to float.
Yeah.
That's why they taught us the first thing to float. When you learn to float, or when you can calm yourself down and you can float, then you can begin to think of what's next, how to save myself, or how to buy time until help gets there. Because if you're in a situation where other persons, or maybe a helicopter or something, can see you panicking or see you in the water, then they will try to render assistance somehow. So they will teach you to be calm, then they teach you how to float, and then they teach you survival,
So
how you survive.
let me ask you a question now. So what happens now if you're around somebody who is panicking and they try to grab you?
That is a very difficult situation, and it's a very good question. You have to somehow disable that person,
Mm.
disable them. If you cannot get
What do
through
you
to
mean? What do you mean disable him?
them, get them to calm, get them to stop fighting, to get you to go down with them. There's several things that you can do to help to disable them, um, to help to save them, actually, and to save yourself.
Well, we were taught you smack them in the face or something because
Hit them on the nose.
because they can pull you down.
Yes, they can pull you down. They can take you with them.
A drunken man is not one to play with.
A drunken man clutches at a straw.
A straw, anything,
Anything.
and he would
Yeah,
not let go.
yeah. So I think what needs to happen in countries like Guyana, particularly where there's a lot of water, is that these techniques need to be taught more. You know, uh, Survival in the water needs to be taught more, because the other thing is, if at a pool situation, there should always be a lifeguard.
They have to be, and that was
Okay?
that was my point. I'm thinking all the time. If anybody going into any lake or water, I know, I can understand traffic, accidents and things like that happen. But if you're going in a swimming pool, in a situation where it's an organized setting, there always should be a lifeguard there, somebody
Always,
to oversee.
always.
You know,
Yeah.
um, I'm wondering, was this man who drowned, was he a lifeguard?
He was not a lifeguard.
Okay,
He was not a lifeguard, but there is normally a lifeguard at the pool.
okay,
But remember, this is after hours.
yeah, And that's the thing. You shouldn't be going into the water
You
after.
should not go into the. You should not go into a pool situation
Yeah,
after it was after 9 o'clock at night.
yeah.
The
It's
pool is already closed. Everyone is already gone.
it's dangerous to
You
do
know,
that. People get.
maybe it's something that he did from time to time. I don't know.
Was
Maybe
he
it's something
drinking?
that he did.
Was he drinking?
Say it again.
Was he drinking?
I have no idea.
Okay,
I have no idea if you. I wasn't there.
okay.
Um,
Well, toxicology they're gonna check his blood alcohol level,
right. Exactly.
all that stuff.
Exactly.
But
And those are all necessary screenings that need to be done in an autopsy.
yeah, yeah, they're gonna do all that
You know.
because that is something that can it can cause you to have a problem. There are people who are drunk and they're going in waters like that
Oh, definitely.
and get a stroke. I mean, he's had a heart attack
Definitely.
and get a stroke.
Definitely. Definitely.
Especially if you have pre-existing medical conditions.
Yeah.
Know what his condition was.
Yeah. The
And
other thing.
yeah,
Go ahead. Go ahead.
no, no, I was saying with your instructions, right, which is very, very good. And when I was in Mackenzie High School, everybody had to go for swimming class, and in order to pass the class, you had to thread the waters for at least 3 or 4 minutes. I mean,
Exactly.
that was the passing for the course.
Mm-hmm.
You have to be able to, and you can't stay close to the wall because more likely when you when you're getting tired, you can grab the wall.
Around the wall. Yeah.
You know,
Yeah.
well, they used to teach those classes. I remember because I took them.
Mm-hmm.
But
Mm-hmm.
with this man though, I mean, he might have been the very best swimmer. He might have been an instructor. He could have been an Olympic swimmer. But when you have a heart attack, you know,
What I saw on the video is that one of his hands was up in the air.
yeah,
Apparently, something also happened to his hands. He couldn't bring it down.
yeah. So he might have had a stroke too.
Possible.
You know,
He couldn't bring his hands down. And when they found him, his hand was on the same position.
yeah.
One hand was up. So
Something.
um, he probably suffered a stroke in the
Yeah.
pool. And he
And, and
couldn't, he
in
couldn't
that
move his
you
limbs.
can't think clearly. I mean, you can't think. You can't think clearly.
Based on the video that I saw, and the video will be up there when I go up there. I'll see it in totality.
My goodness.
It appeared as though he was about 2 feet from the wall,
Wow.
that close.
Close. Maybe he put his hand out to grab the wall.
Maybe he did, and then his hand got stuck right there.
Yeah, yeah. As he succumbed to.
Maybe he was trying to grab the. There's a bar all around the pool. You
Oh,
call
so
it a grab bar.
he probably was trying to grab something.
Maybe he was trying to raise his hands to grab the bar. I
Uh,
don't know.
yeah.
He's not there to tell the story anymore.
My
But it's a bar that is around the pool on the inside that you can grab it if you're in difficulty and you're near the wall. You can reach out and grab that bar.
yeah.
And every pool should have that bar. I don't know if that pool had it, but every pool should have that, so that if you encounter some difficulty, there's a bar you can grab onto. You know.
Yeah.
The other thing that I don't know if they did it in Inland, but he was instructed not to drain the pool.
Not to.
Not to drain the pool at that time, at this time.
Oh no, you can't drain it now. They're gonna have to take samples,
There you go.
all that
There
stuff.
you go.
You
And
know.
that was good advice because I also advised them to make sure that they get a sample of the water
Yeah.
so that when they find the water in his lungs, they can compare the two samples, the
Yeah.
water from the pool, the water from his lung, even though it is clear that he drank.
Yeah. Yeah.
In an autopsy, you want to analyze the water in his lung and the water in the pool, just to give clarity on everything, which is something that should be done at all autopsies in all drowning situations.
Well, in every situation, right? When you do an autopsy, I mean, and when it's done correctly, even this is forensic pathology, so that's a different branch. But in clinical pathology, whenever you do an autopsy, you get whatever content is in the lung. They usually, keep the fluid and so forth that is in the lung, They use blood. They get the blood. They get even urine samples, a lot of samples, you know, and they keep all those things because in
They would have to take that from the bladder directly.
yeah, yeah, you can see the when you do an autopsy, you can see the bladder right there. You just put
Mm.
a syringe in there, you take out the urine. But in pathology, in clinical pathology, they're trying to find uh, the cause of death of the person, right?
Right.
Because he's
Mhm.
he's in the hospital setting or whatever, right? And all of a sudden he's getting treatment. You don't know if he got overdosed. You don't know what's going on. You know, they're not really, and they're looking at the manner of death too, but more on the cause of death. You know, you want to know if what if the person had cancer, they had whatever diseases. So tissue samples are taken, and every liquid, every fluid in the body is taken. You know, blood, urine, even fecal at times. You know, so everything is kept as a record in case there is a need to do a second. Because sometimes people go into hospitals and families may say, well, you know, I think the doctors and the hospital is liable because you know we didn't think he had this disease or we didn't think he had that disease. So autopsies are usually done just to confirm the diagnosis,
Mhm.
you know, in the clinical diagnosis of the person, you know. So they keep everything on record, and so that in forensic pathology they have to do that because you never know. You may think it's the cause of death. You see the person got a gunshot wound and that killed them for sure, but you don't know the manner of that. You don't know the manner of that, and sometimes the manner of death could be poisoned, could be any other thing. Even though you have a gunshot wound, that don't mean that really is that's what killed you. But
Yeah.
the premeditated, what is there any premeditated circumstances, you know, surrounding his death? So you have to, keep everything too in both situations. So I would think that this person had, the young lady had the first autopsy. Everything that is needed should have been kept, you know. And if uh, if they need more lung sample, the lungs should be there, you know. Either they kept it, and that's important to you, because sometimes you don't know certain situations with the organ when you do like a second pathology, you do an autopsy, second autopsy. The second pathologist have to discern whether or not it is the actual way, the original way that the tissue looked, rather than you know because things degrade, right? As you get old, as the time passes, the protein degrades. So they have to take into consideration all of that
Decomposition.
composition exactly. And sometimes in decomposition situations, things look real bad, and you wonder whether or not it was like that in the beginning.
Hmm.
You see, so all those things have to come into play, and it's you have to get somebody who really know what they're doing to do a second autopsy.
What about what about the preservation of the body after the?
Well, that yeah, that could have that's a drawback too because sometimes they take out the vital organs and then they may not put them back in the funeral home or the funeral home and dispose of them. A lot of things happen, man. Strange things happen. So pieces of this organ may be missing or that may be missing. Whole lungs are gone. Things like that. You know. So it's important that hopefully if you're doing like uh, a second autopsy, every structure, every vital organ should be kept and nothing should be missing. But things happen. If they release the body uh, to the funeral home, sometimes some funeral homes, when they do when they do the
Preparation.
preparation of the body, they don't keep all the organs, you know, especially, and it depends on how the autopsy was done.
But in a case of a forensic situation or a suspicious situation where the manner of death is not determined, you would hope that nothing is displaced.
Well, they have to. It's very important that everything is there, you know, and you don't get a case, a situation where the second pathologist is identifying this organ or that organ or whatever, and where it is, and things get mislabeled and things disappear. You don't want that, you know. That creates a lot more problems, and I hope that won't happen. I mean, I'm pretty sure they have very, very credible people to do these things. You know, and
Well, we have to hope that the highlighting that you brought out there is respected and um, is actually what will occur, because it would be a very sad situation to know that um, the second pathologist doesn't find organs and doesn't find this, doesn't find that.
well, I hope not. And I don't think I pray that that's not the situation because that's going to create not a lot of other problems.
I would hope that maybe they opened the body and extracted what they needed and disposed it back, and not
Well,
remove any organs.
for them to do a good autopsy, they have to remove organs. You know, and and the manner in which they do it. I mean, when we used to do it, we used to do is a procedure called Rikitansky, whereby all the organs, especially lungs and everything else, is all still connected. You're able to take it all out.
Right. That's what I mean.
Yeah. So I hope that's how they do it.
That's what I mean. That everything stayed intact,
Yeah.
and they just extracted what they needed and put them back where they belong.
It's sad, man. It's very sad, and for everybody, I'm very sure involved. It's very, very sad.
But let me ask you a question on based on the findings.
Mm.
Um, and I was warned not to talk about this situation, but it's very difficult not to, because persons are expecting that I would do it. It's just that we would have to do it very, very realistic and carefully and cautiously. But
Yeah. Well, I'm not a pathologist, so I can't really. I mean,
you can't pronounce on anything,
no, I can't.
right? None of us are pathologists, but we doctors, and we can speculate, and we can, based on our training, we can have input.
Yeah. I mean, I can. I can't really. I'm not there. A lot of times, when you speculate, the reality is far from
From
this.
what your speculations are.
Yeah.
But the reality is that she was found the next morning.
Yeah, that's sort of. I mean, for everybody involved, I'm very sure everybody would say, well, if they look, because my question would be, okay, you have a pool. She was going to the pool. Everybody knows that. She's missing. That's one of the first things they tell you to do. I mean, you look and make sure that nobody's drowned. Especially if
Right,
the pool is active.
right.
And had they done so, and it seems like as though they did, and she was
It was done. It was done.
so the that I would that's ruled out. Ever totally ruled out if she was not in the pool. I'm pretty sure if they made a police report, that's the police officers. That's probably one of the first thing when they got in the scenes they did that. They probably looked and make sure that nobody's drowned or anything like that, along with everybody else that was looking. So for her to end up in the pool a day later, um, for everybody who knows, who have a brain or a mind, that don't make sense. Okay,
Well, it didn't make sense to me, and it didn't make sense to thousands of
for
people.
everybody, for anybody, if
Yeah.
something is wrong,
And
something
it,
is
it
wrong.
was not that she was just found in the pool. She was found in the pool in a position, in a crouched position basically,
Mm,
and she had when I first saw the video, she had like a chemical on her face that damaged her face and her elbow area or arm, back
mm,
of her arm and the knees. And I know for a fact that because of the pool that we have at Linden, we handle a lot of chlorine,
mm.
and I know for a fact that chlorine
It can,
can damage your skin like that.
yeah, it burns.
It can pretty much burn you. We call it burn, but it can change the color of your skin. Chlorine is like bleach,
Yeah, it is.
and
It is bleach.
her face was discolored. It was seen discolored. Her arm, back of her arms was discolored, and her knee, based on the one I saw. And that right away, my suspicion was chlorine.
Do they keep? Where
Because,
do they keep the chlorine for the pool?
well, there you go. You see, you're not even here, and you could go right to that. And we had no discussion about that. Um, the chlorine, I don't know where they kept it, but it wasn't kept in the pool. It was kept somewhere else.
So was she in that room by chance or anything?
Well, you see, you
No, I
you know,
mean that would be that's one of the first questions. If you see burns, and they look for things that are inconsistent with their
you're
parent.
asking the same questions that I would ask
Yeah. So
based on our exposure and our training and so on. That
yeah.
was my first question. Was she in the room where the chlorine was kept? Because of what I see, and if she was in the room,
Hmm.
um, how did she
What
end
she
up? How did she end up in that room?
and also um, who was working on those days?
All of that. You're asking the same questions I asked. Who
Yeah.
was at work those days
Mhm.
that could have taken her to those areas, or could have seen her going in that area?
Yeah.
Because
Yeah.
I mean, you can't go to a strange place and end up in places where strange people don't go.
Yeah. Well,
You know,
there's a lot of a lot of questions that I'm very sure that I'm not the I'm an investigator and all that stuff, but I'm very sure that the authorities, people who are doing it, they have very same questions, probably more pointing
oh
questions,
yeah,
and they know a lot more.
definitely,
They always know a lot more than what the public knows. You know,
definitely.
they know, and my prayer is that to let the thing investigate and let honest and serious people do what they're doing because it could be anybody else's child. You know,
That's the thing.
if it's something, if it's foul play, they need to find out who the foul is that's playing. You know, somebody's not doing right, and then they may not do right by anybody else's daughter or children or whatever. They need,
Well,
they need to
you
fire.
you have two daughters.
Oh yeah,
I have none,
oh yeah,
and
yeah.
I when I heard what happened to the child, and I saw what I saw,
Hmm.
um, it almost brought tears to me
Wow,
because I knew that it was not, a drowning situation.
wow.
I know what a drowning situation should look like. I saw people who drowned. We talked about it earlier,
Hmm.
and it was stated that she died by drowning. Well, you can drown with a spoon of water.
You can people drowned all the time in the bathtub.
You can drown in the bathtub. You can drown in the jacuzzi. You can drown,
Yeah, yeah. You can
you
drown it.
know. So
You can aspirate.
it could be very possible that this weight is drowning, but what caused it?
Yeah, the manner in which
The manner of the drowning is
yeah, that's
very important. Yeah,
questionable. You know, I don't know. I mean, just from just hearing what you're telling me, it's questionable, and a lot of people. I'm very sure the authorities have the very same. Uh,
concerns.
yeah, they know a lot more. They're not
Yeah,
a lot more. So, and sometimes it's. it's prudent because there were burnings and fires and all sorts of things, right?
Yeah.
Yeah. So cooler heads have to prevail. People need to,
Well, actually, we were on our way back from Florida
mm,
on the night after the finding, I think,
okay.
and we were turned back 20 minutes from Guyana.
Oh wow, 20 minutes from Guyana.
20 minutes from Guyana, yeah,
Why was that?
because the pilot indicated that he was advised, and he, that the announcement they make, prepare for landing, that kind of thing, and that was already done. And then it seems like minutes after, he got back on his mic and stated that we have to divert and land in Trinidad because there was, what did he say? He said there is protests
At the airport?
in Guyana. In Guyana,
What happened? What's
wasn't
happening?
the airport. It wasn't the airport.
He could have landed.
Well, he was advised. He said he was advised
Oh,
not
that,
to. But we learned even then from persons who were communicating with other persons in Guyana that two flights had just landed and there was no issue. But I learned after when we came in the next day from the taxi driver who brought us down that even though the planes landed that night, very very few people left the airport
why?
because of what was happening in Guyana.
I mean, all the roads were blocked.
Some of the roads were blocked. Yeah, yeah. Some of the roads were blocked, and there was burning, and there was also looting and all sorts of things.
Oh,
Yeah, because of I guess because of the what was said, you know.
and
And you have to be so careful with what you say because if I know something and I'm certain about that something that I know, and uh, you come to me and try to tell me otherwise, and I know different, and I know what I know is real, then I'm not going to accept what you say. So
yeah,
it's really it's a troubling situation, and I'm hoping that that honesty prevails. When I say honesty and truthfulness,
yeah.
and I wish that those who really saw what happened,
There are people who saw what happened.
I am quite sure,
Okay,
I am certain because they were not alone.
okay.
There had to be witnesses. There had to be, and
Are they? Are they? Are they? Do they have? Well, they're not going to say now. I'm pretty sure that. I'm pretty sure they have people who they interrogated
I don't know if they did any of that. Maybe not. I don't know, but I think it needs to happen. And um, if I had anything to do with the investigation, I would want everyone who worked that night or that day
hmm
present. I'd want to know who stayed in the rooms, and I would question all of them. And I would question the authorities that were present. You know,
hmm
because someone had to know or see something. And
I'm pretty
this
sure.
is,
I'm pretty sure they can do all that. I'm pretty sure.
I hope so. I
Yeah,
hope so.
they have to. Yeah.
The whole world, Dr. Richard, the whole world is watching the situation.
Really?
The whole world is
Oh,
watching.
wow.
I've seen comments from people in as far as California,
hmm
New York, Canada, the Caribbean. As a matter of fact, there are things that I was fed from persons in the Caribbean that I didn't even know. I mean, there were things happening and I knew nothing, and I'm right here,
hmm
and they were feeding me data of things that were going on, and I didn't know a single thing. So the whole world is watching and is waiting on hopefully a right decision that needs to be made regarding the matter.
Yeah, but if they don't have a suspect, I mean, what decision they're gonna make?
Well, based on
Or they
investigations,
have suspects?
I'm quite sure they do.
Okay,
But if the right investigation is done, you will find the perpetrators.
and
If the right investigate, I've watched and witnessed so many things that were that were um, dealt with in the past in America. Some things happened years ago and all of that, and those investigators, those forensic agents and investigators
mhm,
would resolve issues
yeah,
to the T and had sometimes no evidence.
yeah, but they're using DNA and
All of that need to be used.
spectrometers to go and
All of that needs to be used in a situation like this because let me tell you, um, based on what I'm hearing from people who were not even here,
mhm.
um, if the wrong decision is made about and the wrong investigation is done, I don't know what would happen.
I hope nothing. I hope that
Pray
they
that the right thing is done and the right results come out because we don't need any issues here.
no man, no,
We need peace and tranquility and we need order and
yeah, and
um,
people need to. I think people need to take it easy and
yeah.
also
What I would, and you're saying the right thing. What I would advise persons to do is not be hasty.
no, you can't.
Um, Call for the right authorities to do the investigations, and if you don't believe in the authorities you have, try and seek other authorities that are willing to assist you with investigation. Get the right um, credentials or credentialed ones, and let them do their work. Let
Well,
them do their work because
I'm pretty sure the first individuals that did the autopsies, they were reputable people, right?
stated, yeah.
Yeah, and if they're gonna do a second autopsy, they're gonna have another set of reputable people. So I think it's wise, man, to for the people, for the masses of but by creating unsafe conditions and getting
No, we don't need that.
that makes so sad.
There's no need. Those things that
That
occur
should
in
never
situations like
be.
that, they do not solve issues.
Don't solve anything. No.
They solve nothing. They create more mess. They interfere with people's personal properties, people's lives, and their own lives sometimes are in jeopardy. So we don't need any.
No.
We don't need any turmoil. We don't need any any type of misbehavior.
Yeah.
What we need is order, and we need people to focus on getting answers.
Yeah.
You know,
I mean,
I I would normally I would normally say justice comes from the courts. Justice comes from the courts.
and true justice comes from heaven.
Right? Exactly.
All that, whatever would ever happen to,
Exactly.
it's fully recorded, even though, and I'm wondering, I'm thinking, why wasn't their cameras working?
Well, it's a question that many persons question. A question that many persons question. um, I believe that someone know what happened.
Are the cameras workable? I mean, were they working before, or were they turned off? What was it?
I I have no clue.
Okay, well, all that the police is going to investigate.
I
An
have no
investigator
clue.
is going to
But the
investigate.
funny thing is that the whole building was burnt.
You're kidding me.
No,
Who did that?
well, we don't know. I don't know. The whole building, the whole hotel is burnt. The pool was emptied. I think the next day.
Oh, that was too quick.
Well, it was emptied, and I don't know who gave the order to empty it. But in a situation like that, you like the one at Linden,
Yeah,
you don't empty your pool until the investigation is pretty much completed.
yeah. You leave all the evidence.
It's cordoned off as a crime scene, and it's left there.
Yeah, yeah, yeah. Investigators have to come in. The
Yeah.
officers have to come in. They take pictures. They take everything. You don't. They shouldn't even have moved the body. I mean, the body was floating. Did they move the body also before the
Well, you
investigators
know,
did?
I, I'm trying not to say very much, but
Okay.
based on my little knowledge that I know, I can understand the desperation in the father when he saw the body.
Yeah, yeah.
You know, his desperation was to get her out, or to, his daughter, right?
Yeah, emotions.
Emotions, right? But adrenaline, emotions. But it's a situation where, they say hindsight is 20/20 vision. When
Yeah.
you look back at what you did, you realize you should have done things a little differently.
Mm.
Uh, what I would have done, even though it would have been a panacea situation, I would have made sure I took videos.
I'm
I
pretty sure people took videos.
take videos of the body the way it is, where it was, the way it is, what's the markings. You video everything.
I'm pretty sure that's done because
I'm quite sure it's done.
that's before you do an autopsy. That's the first thing you do. You take
Well,
pictures. You take.
well, I'm not talking about the pathologist. I'm talking about the finding, the day of the
You mean
find.
the crime scene
Yeah,
or the possible crime scene, whatever.
yeah.
You know.
You don't touch the body.
Yeah.
Um,
You leave everything there. Leave
you
all the evidence.
surround the body and you take every picture that you could
Yeah.
where that body is touched. And the other thing is that you want to preserve any fingerprints if there are any. You
Yeah.
know,
Yeah. DNA and all that stuff.
yes, you want to preserve the DNA, the fingerprints,
You know the check.
any
check
chemical spills, anything you want to.
yeah.
You don't want to touch anything because you want to make sure that the right authorities touch that. But that would have been after you would have gotten pretty much everything you could get at that point where you found the body. You know,
And that's the other thing. Whenever whenever a body is found, it doesn't in this country, in whatever county or wherever you may be, um, everything in the scene where that is, it you don't touch it.
exactly.
But when the investigators go, they comb the whole area, okay, and the body goes. Eventually, it takes a while. It goes into the bag. They have a bag that they put the body in, along with everything else that was.
It was discovered.
Yeah, and then they do, the check, take a lot of photos. There's a forensic photographer. You know, I mean, everything is taken, everything is mapped out. You know, so that in event there's a
But
need.
we only have about 2 more minutes.
Oh, okay. In event there's a need to go back to look at certain things, even the clothes, you don't get rid of the clothes,
Yeah.
and they don't touch anything. So when it comes to when we get ready to do the autopsy, everything is there, and we start taking pictures for the minute we zipper the bag and we start taking pictures there. And sometimes evidence outside of the body have been used to indict the individual.
Hmm.
You know,
Yeah.
sometimes. You
Yeah.
know,
Yeah. Because if that body ended up in the pool, and it wasn't in the pool, as it's just stated, someone had to take the body there.
but I'm wondering, did the parents stay at the night there, or nobody at the pool?
You're asking all the questions that I would ask. It's funny.
And I'm pretty sure people were watching.
They were watching, but I don't think. I think everyone was ordered out of the area.
I'm pretty sure there's somebody got a video that
I know. I believe so. I agree with you.
that
I agree with you.
even the authorities may already have that video.
Nothing goes unseen. Somebody saw something,
Yeah,
and I'm quite sure someone recorded something. And hopefully they'll be um,
yeah,
they'll be brave enough and honest enough to present it to the right authorities.
yeah.
Anyhow, Dr. Richard,
We spend a lot of time on this thing here.
yeah, we got, I think you got 1 minute more. We spent all the time on it, all the time on it. And I want to thank you for your input. Thank the guys at the studio for allowing us to delve into that a little bit. But we didn't get to talk about anything regarding, well, the health situation. But
Well,
uh, it was expected that we would discuss this.
and,
And,
and this is very, mental health. At this point in time, I'm very sure that the whole country, those who are involved, mentally, it's affecting.
affecting everyone.
Yeah, so
Everyone.
mental is important.
Yeah. So I want to thank you for your time. Thank the guys at the studio. We'll dive into this some more, I guess, later. And for all of you who are watching, I want to ask you to just pray for the country, pray for the family,
Hmm.
and pray for the results to come out the way they were and the way they occurred. And until we speak again, God bless you. Have a good night. So long.
Yeah, let truth prevail.